Hello, I'm Dr. Leena Khanzode. I'm a child, adolescent, and adult psychiatrist. I'm also the founder and president of Taarika Foundation. Happy World Mental Health Day to all of you. On this occasion of World Mental Health Day today, I'm excited to share the launch of our YouTube channel, Supporting the Whole Child, which is supported by a grant from our community partner, Palo Alto Medical Foundation. Our podcast, Mindful, Beautiful, and Thriving, is also supported by this grant from Palo Alto Medical Foundation, and we are grateful for this opportunity from them. For those of you who do not know much about Taarika Foundation, here is a quick background. Taarika Foundation is a 501c3 nonprofit mental health organization that focuses on mental health in children and adolescents. Our mission is to raise awareness about mental health in children and teens, break mental illness stigma, and improve mental health in children and teens in our community. How do we do this? We educate parents and youth about youth mental health issues by conducting educational talks, workshops, webinars, podcasts, and use social media as a platform to disseminate helpful information to create awareness. We also teach stress management strategies like mindfulness to youth with group therapy sessions and workshops. I would like to make an honest confession about funding for Taarika and its projects. It's a private, nonprofit foundation mainly supported by a portion of my income from my private practice and certainly by grants and donations. I did not start Taarika for name or fame or save money from Uncle Sam, but it was to fulfill my passion and purpose of my life, which is to help kids and their families. So, after all, I am not totally selfless. I'm certainly passionate about the work I do, but let me share where did this purpose come from. Here is the harsh reality about mental health in youth and young adults. 1 in 5 youth have a mental health disorder. 1 in 3 develops anxiety disorder by age 18. The rate of depression has doubled in the last few years. 1 in 5 kids in California have considered suicide, and suicide is the second leading cause of death in age 10 to 18. Let's take a look now what happens to the young adults once they finish high school and start this new journey in their life. This survey that was done by National College Health Assessment in 2018 shows 1 in 4 young adults have a diagnosable mental illness. 62% of them have anxiety, 41% depression, 11% of them have considered suicide, 7.4% have engaged in self harm behavior, and 1.9% attempted suicide. So, in short, we are in mental health crisis, and this pandemic has made things only further worse. I am getting 5 new patient calls per day since the past 2 weeks. I see about 15 patients, which is a lot in psychiatry, per day and cannot fit in anymore. The unfortunate reality is that there are not many trained professionals like me. There are therapists and counselors, but even they are stretching thin now. So this curve is unfortunately only going up each year. And particularly during this time of pandemic, we are seeing a huge steep rise. So the question is, how can we flatten this curve? Based on my work experience in the past 10 years, I have learned that mantra of prevention is better than cure can also be applied to mental health conditions, just like we apply it to physical conditions. So if we can start taking better care of our mental health, we can prevent from that getting worse by education. So if we educate ourselves about picking up the signs and symptoms of a mental health disorder, we can create awareness and talk openly about it. That allows us to not only just do early detection, but also reduce the stigma. And then, of course, by early detection comes the early intervention. If we detect these problems earlier, problems like anxiety, some signs of depression, then we can treat it just with counseling or therapy. But if we wait too long, then you need to come and see a professional like me for medications. So that's what we are trying to do through this work we are doing through Taarika Foundation. We have now moved into getting the education and awareness information in digital format for our very busy parents. And we are doing this through podcasts, webinars, and now we will be doing this through our YouTube channel, Supporting the Whole Child. Through this channel, we will be releasing short videos about education on anxiety, depression, other conditions like ADHD in children and teens. We'll also do a series on parenting to help you raise a whole child. And of course, this will be done through interviewing experts in the field to give you the best and up to date information. So, would you help me to flatten the curve and help with this great cause? You can do this by subscribing to our YouTube channel. We need 100 subscribers watching our episodes for 30 days to customize our channel so we don't need to send you individual links each time. So together we can, and we can also flatten this curve. Thank you very much. Stay safe and healthy.